You're bleeding. Not a paper cut, not a nosebleed. The kind of bleeding that makes the floor slippery. The kind where you look down and your brain takes a full 3 seconds to accept that the dark puddle spreading across the tile is coming from you. There's a hole in your body that wasn't there 5 minutes ago. Something hot and fast punched through you like you were made of wet cardboard. And now your insides are trying to become your outsides. The nearest hospital is either a smoking crater, occupied by people who'd happily put another hole in you, or 300 miles of bad road. No ambulance, no surgeon, no cavalry. Just you, this room, and a decision that has to happen in the next 60 seconds. Because after that, you might not have the blood pressure to make one. Here's what nobody tells you about gunshot wounds. They don't care who you are. A trained operator, a suburban dad, a teenager in the wrong place. Bullet holes are the most egalitarian injury on earth. Flesh tears the same way whether it's wrapped around a billionaire or a nobody. And here's the other thing. Most victims don't die from the bullet. They die from the bleeding. They die from the infection 3 days later. They die from shock while staring at the ceiling, wondering why the room is getting so dark. This means if you can manage the bleeding, fight the infection, and keep your body from shutting down, you can survive this. People have survived worse with less, but you need to start now. Not after you've calmed down, not after you've processed what just happened. Now. Step 1. Stop the bleeding before your body runs out of reasons to keep going. For the next 5 minutes, the only problem that matters is the blood leaving your body. Not the pain, not the fear, not the existential dread. The blood. Find something absorbent within arm's reach. A shirt, a towel, a curtain yanked off the rod, even a sock if that's all your dying hands can grab. Fold it into the thickest pad you can manage and press it directly onto the wound. Not gently, hard, like you're trying to push the blood back in, because functionally, that's exactly what you're doing. Your body is already trying to save you. Millions of platelets are rushing to the wound like microscopic construction workers, trying to stack themselves into a clot, a biological dam. Your job is to help them. Pressure gives them something to build against. Without it, they're trying to build a wall in a river. Hold the pressure. Don't lift the cloth to check if it's working. Of course it's still bleeding. You have a hole in you. If the cloth soaks through, do not remove it. Your instinct will be to swap it for a clean one. Fight that instinct. That blood-soaked cloth is now part of the clot. Removing it rips away everything your body just built. You'll bleed faster. Add another layer on top, then another. You're building a compression sandwich, and the filling is your survival. If the wound is on an arm or leg, get it above your heart. Prop it on a chair, a stack of books, anything. Gravity is free and it works. If the wound is on your torso, you can't elevate your liver. Just keep pressing. Press harder. If the wound is on your chest, stop. That's a different problem. It will kill you in a specific way that requires a specific response. But right now, you've addressed the most immediate threat. You've given yourself the next 5 minutes. Survival isn't a single event. It's a chain of moments, of problems solved one at a time. And you just won the first one. Now, hold on.
Step 2. The tourniquet decision. When pressure isn't enough and time isn't your friend. Watch the blood coming out. I know that sounds psychotic, but you need to read it. If it's dark red and flowing steadily, your pressure and elevation strategy is probably enough. Keep holding. You've got time. If it's bright red and pulsing, rhythmically spurting in time with your heartbeat like a broken sprinkler head, that's arterial bleeding. That means a major artery has been hit and you're losing blood faster than pressure alone can stop. An adult has roughly 5 liters of blood. Arterial bleeding can drain a liter in 3 to 4 minutes. Do the math while you still can. You need a tourniquet now. Find something 2 to 3 inches wide, a belt, a rib strip of denim, a dog leash, a bandana folded double. Width matters. Anything narrower than an inch, shoelaces, wire, thin rope, will slice through tissue and muscle like a cheese grater. You'll still lose the limb, just more painfully. Wrap it around the limb a few inches above the wound, not on the wound, above it, between the hole and your heart. If the bullet hit your calf, the tourniquet goes on the thigh. If it hit your forearm, the tourniquet goes on the upper arm. You're cutting off blood flow to everything below the tourniquet, so position matters. Tie it tight. Then find something rigid, a stick, a screwdriver, a pin, a spoon handle, a piece of rebar. Thread it through the tourniquet and twist. Keep twisting until the bleeding stops, not slows, stops. This is going to hurt more than the bullet did. I'm not being dramatic. Tourniquet pain is a special kind of agony that makes your vision white out and your vocabulary reduced to single syllables. That pain is how you know it's tight enough. If it doesn't hurt badly, it's not working. Now here's the part most people forget. Mark the time. Write it on your skin with a marker, a pen, charcoal, your own blood if nothing else is available. Write a T and the time. T 1430, whatever it is. A tourniquet left on too long kills the limb. The tissue below the tourniquet is being starved of oxygen. You have roughly 2 hours before cells start dying in numbers that make amputation inevitable. After 6 hours, the limb is dead, and the toxins from dying tissue will poison your bloodstream when you release the tourniquet. 2 hours. That's your window to figure out something better. After 2 hours, you're choosing between losing the limb and losing your life. Neither option is good, but one of them has a future attached. Releasing the tourniquet. After about 90 minutes, if the direct pressure bandage is holding and the bleeding seems controlled, you can try a gradual release. Slowly unwind the rigid stick 1/4 turn. Watch the wound. If bright red arterial blood starts pulsing again, immediately retighten. If the bleeding stays controlled with just the pressure bandage, continue slowly releasing over several minutes. Never yank a tourniquet off all at once. The sudden rush of blood can restart hemorrhaging violently.
Step 3. Chest wounds. The special hell that requires special treatment. If the bullet entered your chest, everything I just said about packing and pressure still applies, but you have an additional problem that will kill you faster than blood loss. A hole in your chest wall means air is getting into your chest cavity where air doesn't belong. Every time you breathe in, air enters through the wound instead of just through your nose and mouth. This air pushes against your lung, collapsing it. If enough air accumulates, it pushes against your heart and your other lung too. This is called a tension pneumothorax. It's as bad as it sounds. You'll know this is happening because breathing becomes progressively harder even though you're trying harder. You might hear a sucking or whistling sound at the wound with each breath. Your neck veins might bulge. The injured side of your chest stops moving normally. The fix is crude but effective. You need to seal the wound with something airtight. Plastic wrap, a section cut from a trash bag, the wrapper from a bandage package, even a credit card taped down. Anything that prevents air from entering the wound. Here's the critical part. Seal it on 3 sides only. Leave one edge untaped, creating a flutter valve. When you breathe in, the plastic seals against the wound and prevents air from entering. When you breathe out, the loose edge lifts slightly and allows trapped air to escape. If you seal all 4 sides, you trap the air that's already inside, and it continues collapsing the lung with no way to escape. 3 sides. This is not negotiable. Tape it down with whatever you have. Medical tape, duct tape, electrical tape. Press the sealed edges firmly against the skin. If the skin is bloody and tape won't stick, wipe the area as dry as possible first. Then monitor your breathing. If it improves, your flutter valve is working. If it continues deteriorating, the seal isn't holding or there's too much air already trapped. In that case, you're in territory that requires chest decompression, which involves puncturing the chest wall with a large needle to release trapped air. That's a procedure that saves lives, but can also end them if done wrong. If you don't have specific training, the 3-sided seal is your best option. Step 4. Abdominal wounds, when your guts make an uninvited appearance. Gut shots are terrifying for a specific reason. If organs are visible through the wound, your instinct will scream at you to push them back inside. Do not push them back inside. Exposed intestines that get shoved back into a contaminated abdominal cavity will almost certainly cause peritonitis, a massive internal infection that kills even with hospital care. Without hospital care, it's essentially a death sentence. Instead, cover the exposed organs with a damp dressing. The moisture matters. Dry cloth sticks to intestinal tissue and causes further damage when removed. Wet a clean cloth with sterile water, boiled and cooled water, or the cleanest water available. Lay it gently over the organs. Then cover the moist dressing with a dry layer to keep in the warmth and moisture. Do not pack an abdominal wound the way you'd pack a limb wound. The internal organs are too delicate, and the risk of pushing contamination deeper is too high. Keep the person still if possible. Movement shifts organs and can worsen internal bleeding.
If they need to be transported, keep them on their back with knees slightly bent to reduce tension on the abdominal muscles. Abdominal wounds are the ones most likely to require actual surgical intervention to survive long-term. Your field treatment is buying time. Hours if you're lucky, days if you're very lucky. But time is better than no time.
Step 5. Clean the wound or invite every microorganism in the building to a party inside your body. Congratulations, you're not dead. The bleeding is controlled. Now comes the part where you prevent the things you can't see from finishing what the bullet started. A bullet doesn't travel alone. It carries with it fragments of your clothing, dirt, skin bacteria, and whatever filth was on the surface it passed through before entering you. All of that is now inside your body, setting up camp in warm, moist tissue that bacteria consider a 5-star resort. You need to irrigate the wound, not dab at it, not wipe it. Flush it with volume and pressure, like you're trying to evict every microscopic squatter. Boil water if you have the means and time. Let it cool until you can comfortably put your hand in it. You're cleaning a wound, not cooking one. No stove? Bottled water. No bottled water? Tap water. No tap water? Collected rainwater. The hierarchy of wound irrigation is sterile is best, clean is good, questionable is better than nothing. Even water that you wouldn't drink is probably acceptable for wound irrigation because the alternative is leaving debris and bacteria inside your body to multiply. Pour it directly into the wound, not a gentle trickle, a steady stream with enough pressure to dislodge material from the tissue. If you have a squeeze bottle or a plastic bag with a small hole poked in it, even better, improvised pressure irrigation. If you have saline solution, that's ideal. If you have diluted iodine like betadine, use it around the wound, but not deep inside it. Iodine kills bacteria, but also damages healthy tissue in high concentrations. If you have hydrogen peroxide, use it once and once only. The foaming action helps lift debris from the wound, but peroxide destroys the new tissue your body is trying to grow. Repeated use slows healing dramatically. If you've got vodka or whiskey, and I know you've been waiting for this part, save it. Alcohol doesn't sterilize as effectively as you think. It does cause excruciating pain that could send you into shock, and it damages tissue. Drink it later when you need to forget this day, but don't pour it in the wound. Pat the area dry with the cleanest cloth available. Let's be honest, in a post-collapse scenario, clean is a relative term. You're not aiming for surgically sterile. You're aiming for better than the bullet provided.
Step 6. Pack the wound, because holes don't fix themselves and wishful thinking isn't a medical intervention. The wound is clean, or as clean as you're gonna get it. Now, you need to fill it. First, assess what you're working with. If the bullet went through you, entry and exit, you have 2 wounds to deal with. Entry wounds are typically small. Exit wounds are typically larger and uglier because the bullet tumbles and deforms as it passes through tissue. Both need packing. If the bullet didn't exit, you have 1 wound and a piece of metal somewhere inside you. Leave the bullet alone. I cannot stress this enough. Do not dig for it. Your instinct, fueled by every Western movie you've ever watched, will tell you to get the bullet out. Ignore that instinct. Digging for a bullet with improvised tools in unsterile conditions will cause more damage than the bullet sitting quietly in tissue. Surgeons with imaging equipment and sterile operating rooms sometimes leave bullets in place permanently because removal causes more harm than leaving them. You, with a pair of pliers and a flashlight, are not going to improve on that calculus. Pack the wound. Find sterile gauze if available. Clean cloth strips if not. Even tampons work surprisingly well for smaller wound cavities. They're literally designed to absorb blood and expand to fill a space. Start at the deepest point you can reach. Using your fingers or tweezers, push the gauze firmly into the wound channel. Not violently, firmly. You're filling the cavity to create internal pressure that helps stop bleeding you can't see and gives your tissue a framework to rebuild on. Layer it. Don't shove a wad of cloth in and call it done. Strip by strip, building from the bottom up, filling every bit of space. Think of it like piping a pipe with tobacco, if the pipe was made of your own flesh and the stakes were somewhat higher than a nice smoke. The tension should be firm, but not crushing. Too tight and you cut off circulation to surrounding tissue, causing more damage. Too loose and it's decorative rather than functional. You want the pressure equivalent of a confident handshake, not bone-crushing, not limp. The kind that says, I know what I'm doing, even when you absolutely don't. If there's an exit wound, pack that one too. Same technique. Start deep, build up, firm but forgiving. Once both wounds are packed, cover everything with the largest clean dressing you can find. Tape it down securely. Medical tape is ideal. Duct tape is the undisputed champion of apocalyptic medicine. Electrical tape works, packing tape works. If all you have is Scotch tape, layer it like your life depends on it, because it does. Step 7. Fight the infection or lose the war you just won. Here's the cruel joke about surviving a gunshot wound. The bullet might not kill you, the bleeding might not kill you, but the infection that sets up shop in the wound 3 days later, that one's patient. That one waits until you think you're safe. Infection is the sequel that's worse than the original. If you have antibiotics, start taking them immediately. Amoxicillin, doxycycline, ciprofloxacin, cephalexin, anything broad spectrum. Follow the dosage instructions. Take the full course even if you feel fine on day 3, especially if you feel fine on day 3. Feeling fine is the lie your body tells you right before the bacteria regroup and launch a counterattack. Don't take random antibiotics you found in an abandoned medicine cabinet without knowing what they are. Antibiotics are more effective for skin and tissue infections than others. Cephalexin and doxycycline are good choices for wound infections. Amoxicillin is decent. Ciprofloxacin works, but has side effects that make an already bad situation worse. No antibiotics at all? Okay, don't panic. Humans survived wounds for thousands of years before antibiotics existed. They just survived them less often. Let's improve your odds.
Honey, real honey, not the processed corn syrup in a bear-shaped squeeze bottle. Actual raw honey has genuine antimicrobial properties. It creates a low pH environment that bacteria can't thrive in. It produces small amounts of hydrogen peroxide naturally, and it draws moisture out of bacterial cells through osmosis. This isn't folk medicine wishful thinking. Hospitals use medical-grade honey on wounds right now in the modern world with science behind it. Smear it directly on the wound before you dress it. Apply a thick layer. Change the honey dressing daily if you can. Garlic is another option. Crush fresh cloves and mix with a small amount of oil to make a paste. Apply it to the gauze that contacts the wound. Allicin, the compound that makes garlic smell like garlic, has documented antibacterial properties. You'll smell like an Italian restaurant during a power outage, but you might keep your blood free of sepsis. Turmeric mixed with honey creates a paste with anti-inflammatory and antimicrobial properties. It's been used on wounds in traditional medicine for centuries. Again, not your first choice, but your first choice is Zhang. Whatever you use, change the dressing daily. Each time you change it, inspect the wound. You're looking for signs of infection, increasing redness spreading outward from the wound, swelling, warmth, foul smell, pus that's green or yellow, and red streaks extending from the wound towards your heart. Those red streaks mean the infection has entered your lymphatic system and is spreading. That's an emergency within your emergency. Step 8. Manage the pain or lose your ability to function. Nobody talks about pain management in survival scenarios because it's not dramatic enough, but pain will compromise your ability to do everything else on this list. Pain makes your hands shake, pain makes you breathe fast and shallow, pain triggers shock, pain makes bad decisions feel logical. If you have painkillers, use them strategically. Ibuprofen reduces both pain and inflammation, but it also thins your blood slightly, which could increase bleeding. Don't take it during the active bleeding phase. Once the wound is packed and bleeding is controlled, ibuprofen can help. Acetaminophen handles pain without the blood-sting effect, safer during the bleeding phase, less effective against inflammation. Aspirin is off the table entirely, too much blood-thinning effect. Save it for heart attacks, not bullet holes. If you have stronger painkillers, prescription opioids from a medicine cabinet, use them only when you're in a safe location and can afford to have reduced alertness. Pain medication that makes you drowsy in a dangerous environment trades one problem for a worse one. No medication at all, pain management still exists. Controlled breathing. Slow inhale through the nose for 4 counts. Hold for 4 counts. Slow exhale through the mouth for 6 counts. This activates your parasympathetic nervous system and directly counteracts the fight-or-flight response that amplifies pain. Cold application. If you have anything cold, ice, a cold wet cloth, a can from a cold stream, apply it near but not directly on the wound. Cold numbs merc endings and reduces swelling. Distraction and task focus. Give yourself a job. Inventory your supplies, count your water, plan your next move. The brain can only fully process a limited number of inputs. Occupying it with tasks reduces the bandwidth available for pain processing. Talk yourself through it, out loud, not in your head. Verbal self-direction activates different neural pathways than internal monologue and has been shown to improve performance under extreme stress. Tell yourself what you're doing and why. I'm changing the dressing now. This is going to hurt, but it needs to happen. The wound looks better than yesterday. I'm going to make it. You're not crazy for talking to yourself. You're using a technique that special operations soldiers train specifically to use. Step 9. Monitor for shock. Shock is your body's panic attack, is the physiological equivalent of your brain deciding the situation is so bad that it should start shutting down non-essential systems to preserve the core. Except your body is terrible at deciding what's non-essential, and the shutdown process itself can be fatal. More people die from shock after traumatic injuries than die from the injuries themselves. This is not an exaggeration. This is trauma medicine's dirty secret. Watch for the signs. Pale or grayish skin, especially around the lips and fingernails. A pulse that's fast and weak, like a bird's heartbeat under your fingers. Rapid, shallow breathing. Skin that's cool and clammy. Confusion or disorientation. Intense thirst. Nausea. A sense of impending doom that feels different from the reasonable fear of having been shot. Here's the darkly funny part. If you're checking these symptoms on yourself and you realize you're confused, that's a very reliable indicator that you're in shock. The confusion that prevents you from recognizing confusion. Your body has a sick sense of humor. If you feel shock coming on, or if you recognize the signs in yourself while you still can, do the following. Lie down. Get horizontal. Your heart is struggling to pump reduced blood volume to your brain. Being horizontal makes its job easier. This is not optional. Lie down. Elevate your legs above your heart if possible, 12 to 18 inches. Rest them on a chair, a box, a pile of clothes. You're using gravity to redirect blood from your legs to your vital organs. Exception, if the wound is in your chest, don't elevate the legs. Sit up at a 45-degree angle instead to keep blood from pooling in your lungs. Get warm. Shock makes you cold because your body is diverting blood from your skin to your core organs. The cold accelerates the problem. Blankets, jackets, sleeping bags, another person's body heat, whatever you have, wrap yourself up. Sip fluids, small amounts. Water is fine. Water with a pinch of salt and a small amount of sugar is better because it replaces electrolytes. Don't chug. Your stomach is not interested in processing large volumes right now, and vomiting while you're in shock could kill you through aspiration. Do not eat. Your digestive system has essentially shut down. Food will just sit there and make you nauseous. If possible, don't be alone. Another person monitoring your condition is invaluable because shock impairs your ability to assess yourself accurately. If someone else is present, have them check your pulse every 15 minutes and watch for deteriorating consciousness.
Step 10. The first 72 hours. You made it through the first hour. Your odds just doubled. Now comes the part nobody covers. The next 3 days are when infection establishes, when dehydration from blood loss becomes critical, and when the psychological weight of what happened starts pressing down. Hydration is your top priority after bleeding control. You lost blood, and blood is mostly water. Your body needs fluid to maintain blood pressure, deliver oxygen, and support the immune response that's fighting to keep your wound clean. Drink small amounts constantly. Not big gulps every few hours. Consistent small sips throughout the day. If you can make oral rehydration solution, 1 liter of clean water, 6 teaspoons of sugar, half a teaspoon of salt, that's dramatically more effective than plain water at maintaining blood volume. If the person is unconscious or can't keep fluids down, and I'm going to tell you something that sounds bizarre but is actual field medicine, rectal hydration works. Water or saline solution administered rectally is absorbed efficiently by the colon. Medical professionals use this technique when IV access isn't available. It's undignified. It works. In a survival scenario, dignity is a luxury you can revisit later. Change wound dressings once daily.
Each time, clean the wound with your best available water, inspect for infection signs, apply honey or antibiotic if available, repack, and redress. Track your temperature if you have a thermometer. Fever means infection. Low-grade fever in the first 24 hours might just be your body's inflammatory response. High fever after 48 hours is almost certainly infection and means your antimicrobial strategy isn't working. Escalate whatever you're doing. Watch the wound edges. Healthy healing looks pink and slightly moist. Infection looks red, swollen, hot, and angry. If red streaks are extending from the wound toward your heart, the infection is spreading into your bloodstream. This is sepsis territory. Without effective antibiotics, sepsis has a very high mortality rate. This is the scenario where you throw everything at it: honey, garlic, every antibiotic you can find, and hope. Rest. Your body is burning enormous calories rebuilding tissue, manufacturing blood cells, and fighting infection. Sleep as much as you safely can. Eat protein if available. Any meat, beans, nuts. Your repair systems need amino acids to build new tissue. Your body is an ancient survival machine that has been dealing with traumatic injuries for millions of years before medicine existed. Blood clotting is your platelets recognizing damage and rushing to the site like emergency workers. They stick together, forming a mesh that traps red blood cells and creates a plug. The pressure you apply gives them a surface to build against. Without pressure, they're trying to build a dam in a moving river. With pressure, they're stacking sandbags against a wall. Tourniquets work by simply stopping blood from reaching the wound. No blood flow, no bleeding. But the tissue below the tourniquet is also starved of oxygen, which is why there's a time limit. You're borrowing time from the limb to save the body. Wound packing creates internal pressure in spaces where your hands can't reach. It also provides a physical scaffold that your body's repair cells use as a framework to build new tissue. Without packing, the wound cavity fills with blood that clots randomly and creates pockets where bacteria thrive. Honey works because it's a hostile environment for bacteria. It has low water activity, which dehydrates bacterial cells. It's naturally acidic, and an enzyme called glucose oxidase slowly produces hydrogen peroxide at concentrations that kill bacteria without damaging your tissue. Evolution spent millions of years designing honey to not spoil. That same preservation chemistry protects your wound. Your immune system does the real fighting. The white blood cells patrolling your body are remarkably effective at destroying foreign organisms. Everything you're doing, cleaning the wound, applying antimicrobials, managing infection, is just supporting your immune system so it can do its job.